Question number 1. What is the most common type of cancer in women globally? The correct answer is B, breast cancer. Question number 2. Which cell type is typically involved in leukemia? The correct answer is C, white blood cells. Question number 3. What is the primary treatment for solid tumors? The correct answer is C, surgery. Question number 4. Which stage of cancer indicates distant metastasis? The correct answer is D, stage IV. Question number 5. What is the meaning of carcinoma? The correct answer is C, tumor of epithelial tissue. Question number 6. Which cancer is strongly linked to tobacco use? The correct answer is C, lung cancer. Question number 7. What does TNM staging system stand for? The correct answer is A, tumor nodes metastasis. Question number 8. Which tumor marker is associated with prostate cancer? The correct answer is C, PSA. Question number 9. Where does leukemia originate? The correct answer is B, bone marrow. Question number 10. What is the side effect of chemotherapy on hair? The correct answer is B, loss. Question number 11. Which vitamin is linked to colon cancer prevention? The correct answer is C, vitamin D. Question number 12. Who is at highest risk for cervical cancer? The correct answer is B, women with HPV. Question number 13. What is the common early symptom of colon cancer? The correct answer is C, blood in stool. Question number 14. Which screening test detects breast cancer? The correct answer is C, mammography. Question number 15. What is a benign tumor? The correct answer is B, non-cancerous. Question number 16. Which gene is associated with breast cancer? The correct answer is B, BRCA1. Question number 17. What is neutropenia? The correct answer is D, low neutrophil count. Question number 18. Which cancer spreads well lymphatics? The correct answer is C, breast cancer. Question number 19. Why is radiation used in cancer therapy? The correct answer is B, destroy cancer cells. Question number 20. What does a PET scan detect in oncology? The correct answer is C, metastasis. Question number 21. Which symptom is common in brain tumor patients? The correct answer is C, headache. Question number 22. What is the purpose of palliative care in cancer? The correct answer is C, provide comfort. Question number 23. When is chemotherapy given after surgery? The correct answer is C, adjuvant. Question number 24. Who should receive HPV vaccination? The correct answer is C. Young girls. Question number 25. Which cancer is linked with asbestos exposure? The correct answer is B. Mesothelioma. Question number 26. What is the function of colony stimulating factors? The correct answer is C. Stimulate WBC production. Question number 27. Which chemotherapy route is most common? The correct answer is B. IV. Question number 28. Why do cancer patients feel fatigue? The correct answer is C. Low blood cells. Question number 29. What is mucositis in cancer treatment? The correct answer is B. Mouth sores. Question number 30. What is the primary cause of cervical cancer? The correct answer is C. HPV. Question number 31. Which cancer treatment affects fertility? The correct answer is C. Radiation. Question number 32. When does cancer become metastatic? The correct answer is C. Spreads to distant organs. Question number 33. Who classifies tumors as benign or malignant? The correct answer is D. Pathologist. Question number 34. What causes nausea in chemotherapy patients? The correct answer is B. Medications. Question number 35. What is a biopsy? The correct answer is D. Tissue sample analysis. Question number 36. Which side effect is most urgent in neutropenic patients? The correct answer is A. Fever. Question number 37. Where do lymphomas develop? The correct answer is B. Lymph nodes. Question number 38. Which cancer is diagnosed with CA125 marker? The correct answer is C. Ovarian. Question number 39. Which intervention prevents chemotherapy-induced vomiting? The correct answer is C. Antiemetics. Question number 40. What is the function of HER2 in cancer? The correct answer is C. Growth promoting protein.